common complaint that patients come in for are sunspots. So that's something that we tend to address during our visits. And sometimes they are as simple as somebody's had a lot of sun exposure, and it tends to be more of a cosmetic approach to treating those. And then sometimes they do tend to be some precancerous spots, and sometimes something that we would need to take a sample of. It is quite amazing the power that sunscreen holds, because it really is quite a key to helping prevent any cancerous spots from coming and for just general anti-aging purposes. We usually recommend having you apply sunscreen daily. And the recommendation really stems from our constant exposure, even when we don't realize we're being exposed. So that comes from driving in the car, walking outside, and it also comes from even on a cloudy day or when it's cold outside. People tend to think they might be not getting exposed as much, and really we're always going to be exposed to the sunlight, the damaging light. In our office, we see a lot of patients that have those resulting damages. So on the medical side, we tend to see some either precancerous or cancerous spots that we have to address. And then on the more cosmetic side, we see people who are unhappy with either wrinkling skin, sagging skin, or just kind of a decrease in collagen overall. 1 in 5 people are diagnosed with skin cancer in their lifetime, which is a very high statistic. And that skin cancer does stem from sun damage, and that's the leading cause of it. So that's why we're so passionate about sunscreen and the importance of protecting your skin now so that you don't have to suffer down the line.
So within ultraviolet spectrum, which is invisible to our eyes, we have 2 different types of rays. First of them is UVB, which causes sunburn. It plays a major role in developing skin cancer. The other one is UVA, which is responsible for wrinkles and premature skin aging. The Skin Cancer Foundation recommends applying sunscreen at least 30 minutes before going outside and reapplying every 2 hours, or at least after swimming or any sweating exercises.
So then as far as types of sunscreens, there's lots of different types. Depending on what you're looking for. So there's creams or gels or sprays. I usually say for sprays, you spray them in your hand first and then apply, because sometimes when you're on the beach and you spray it, the wind kind of takes most of it. There's also sunscreen in your makeup, which is always good, but I definitely recommend wearing a sunscreen as a base, as a moisturizer, because sometimes you don't apply enough of the makeup to get that full SPF rating, but it always is helpful to layer sunscreen. So you could put a sunscreen on your face and then have SPF in your makeup, in your powder, and that's just gonna give you extra layers of protection. Usually, chemical sunscreens are nice because those blend in really well. Those ingredients, usually on the label, it might say like avobenzone. It usually blends in very nicely, but sometimes it can be irritating to the skin. And then mineral sunscreens are maybe better for sensitive skin, but sometimes they can leave more of a white cast. For the face, I really like K-beauty or Korean sunscreens, just because they tend to blend in really nicely, and they're very cosmetically friendly, like under makeup. So there really is an option for everyone. Usually for the body, I recommend at least a shot glass worth, and then for the face, like 2 fingers. If you just squeeze on your 2 fingers, about that much should go on your whole face per day.
I'm Amira. I'm one of the derm PAs here at Edgebrook Dermatology. I know a lot of our girls have talked about all the different sort of sciencey stuff about all UVB rays, different types of sunscreen. I'd like to talk to you about what happens during a skin exam. Why are they important? At those skin exams, that's really where we can find out if there is a problem. The majority of our skin exams are benign, just like when you go to the dentist or go to the eye doctor. Most of the time, it's just a quick in and out benign exam. If there's something there that we can find, though, that is where we're going to see it. So what happens? You come in, you fill out some paperwork, we put you in a gown, you stay completely covered the whole time. We go body part by body part, we just make sure we don't see any problems. If you have any problems with any area that are looking at, you can let us know, and then we can address those as we go. So what are we looking for? We're looking for your moles, right? We want to create a good, accurate map of your moles. So how big are they? Where are they? Are they raised, flat, dark, pink? Do they hurt? Anything like that. And then we just monitor that once a year. When we're talking about skin cancer, there are many things to look for. We're looking for things that are dark, that are changing, but we're also looking at pink things. I have seen personally basal cells that are as simple as a chickenpox mark that has not gone away. That can be a clue to something like a basal cell. And then all ages, right? So we have found skin cancers on people as young as in their 20s. We've found it in people's 30s, 40s, 50s, all the way up through. So really it's something that you want to start doing when you're an adult. All members of the family should do it. Even if you're not someone that wears a lot of sunscreen that has has a lot of sun damage and you're embarrassed about, thinking that we're gonna yell at you for being in the sun. That's not the case at all. Personally, I wish everyone wore sunscreen, but I also understand that there's a large population of people that just don't believe in it or don't like it, or they just can't remember to do it. And that's okay. When you come in for your skin exam, we'll just make sure that any accrued damage hasn't culminated into an actual problem that we need to treat.